In the first part of this program, you will view a short video about colon cancer and some of the tests that check your colon. After that, you will see more information that you can view and listen to at your own pace. Click the next arrow below when you are ready to move on.
If you're like most people, the thought of getting colon cancer or even going for a colon cancer test can be frightening to you. What if they find something, you're probably thinking? Then what? Besides, colon cancer deals with a part of the body that is, shall we say, not easy to talk about. Well, the good news is colon cancer is a cancer that can be found and removed before it has a chance to become a danger to you. Colon cancer is cancer of the lining of the lower parts of the bowel, called the colon and the rectum. Colon cancer is one of the most common cancers. Both women and men can have it. And the chances of having it increase as you get older, starting sharply at age 50 and continuing as you age. Fortunately, you do have the power to keep colon cancer out of your life. Let me tell you how. Most colon cancers start with a growth called a polyp. If you find and remove the polyp early, you can prevent cancer from even occurring. How do you find it early? There are several ways. Here are two of them. There are tests that can detect tiny amounts of blood in the stool, and tests that use flexible instruments for a direct look at the inside of the colon. Let's see how these tests work. Very early changes in the lining of the colon often bleed. The amount of bleeding may be so small that it's not enough to see. But a special test called the fecal occult blood test can detect these small amounts of blood and act as a warning. There are different ways to check for blood in the stool. Let's talk about the most common test used today. Your doctor will give you a kit to test your stool. The test is very simple. Read the instructions on your kit about how to collect your stool. Collect a small amount. You don't need much. Smear it on the collection card. Return the card to the lab or to the doctor's office. If the test shows blood, your doctor will want to do other testing. If the test was normal, you will need to repeat it in a year. It is that simple. The lining of the colon can also be examined with flexible instruments. Colonoscopy uses a tube to take a look at the entire colon. You'll need to be on a clear liquid diet for 1 or 2 days. The night before the procedure, you may take a strong laxative, which may be followed by a large amount of fluid. A colonoscopy is done by a specialist, a gastroenterologist, or a surgeon, in an operating room or a procedure room rather than in your doctor's office. You'll probably be given medications to help you relax and maybe even go to sleep. The procedure will take about an hour. If the doctor sees anything unusual, he can take a sample and examine it for cancer. If he finds a polyp, he can remove it. After the procedure, you'll need a friend or relative to drive you home. Fecal occult blood test, colonoscopy. Each has its own advantages and limitations. The fecal occult blood test is simple and inexpensive and needs to be done every year. The preparation for a colonoscopy can be uncomfortable, but you'll be given medications to help you relax. A colonoscopy does offer the most thorough look at the entire colon. And if nothing is found, you won't need another test for 10 years. The choice of tests depends on what you are comfortable with and which tests are available. If you have a family history of colon cancer, or if you have certain medical conditions, a colonoscopy will probably be suggested. Remember, most colon cancers can be prevented or successfully treated if they're found early enough.
Each of the tests discussed in the video can lower your chances of getting colon cancer and dying from it. The two most common tests are colonoscopy and the stool test. The stool test you saw in the video showed the patient using a stick to place some stool onto a card. In a newer form, called the FIT test, you put the stick in a collection tube that you then send to the lab or the doctor's office. Let's review the advantages and disadvantages of colonoscopy and the stool test. There are several advantages to having a colonoscopy. It is the most thorough colon test. Any polyps that are found can almost always be removed on the spot. If no polyps are found, there is no need to be tested again for 10 years. Colonoscopy also has some disadvantages. The preparation, or cleaning out your bowel, may be uncomfortable. The test must be done in a hospital or similar facility. Because you will be given medicine that makes you sleepy, someone has to drive you home. Finally, your insurance may not cover the entire cost, so it can be expensive. The stool test has several advantages. It is easy to do, it is done at home, and there is no need to clean out your bowel. The disadvantages of the stool test are that it must be done every year. Collecting a small sample of stool may be unpleasant for some people. And, if blood is found, that is, if the stool test is positive, you'll need to have a colonoscopy. Now that you are familiar with colon cancer and 2 tests to check your colon, let's take a closer look at how these tests protect you. Let's first look at colonoscopy. A colonoscopy won't find every polyp, but it will find most of them. As polyps get larger, colonoscopy gets better at finding them. If a polyp turns into cancer, colonoscopy will almost always find it. It's possible for a colonoscopy to miss a cancer, but it happens only rarely. By finding and removing polyps before they turn into cancer, colonoscopy reduces your chance of getting colon cancer. And by finding cancers early, when they can be more easily removed and successfully treated, colonoscopy reduces your chance of dying of colon cancer. What are your chances of getting and dying from colon cancer? Among people who never get a colon test, most won't get colon cancer during their lifetime, but some will. And of those who do get colon cancer, a significant number of them will die from it. But having a colonoscopy every 10 years, or as recommended, significantly lowers the chances of getting colon cancer and of dying from it. If you have a colonoscopy and it doesn't find any polyps or cancer, there is no need to be tested again for 10 years. If polyps are found, you will need to have another colonoscopy sooner. Colonoscopy does carry some risks. Very rarely, people having a colonoscopy need to be hospitalized because of heavy bleeding or injury to their colon. Next, let's consider how well the stool test protects you from colon cancer. If you have a small polyp in your colon, a stool test usually will not turn positive since the polyp is not bleeding. But larger polyps are more likely to bleed, typically small amounts of blood that cannot be seen. And even a small amount of blood can turn a stool test positive. If a polyp turns into cancer, it often bleeds a small amount and makes the stool test positive. But some cancers will not bleed, and a stool test will miss those. Should you be concerned that a stool test could miss a polyp or cancer in your colon? There are a few things to think about as you consider this question. First, very few people getting tested have cancer. Second, most polyps do not turn into cancer, even if they are never found. Third, as polyps get larger, their chance of bleeding goes up, and most colon cancers bleed. So even if one stool test is not positive, the test may be positive the next year. This is a key reason why stool tests must be done every year. Doing a stool test every year and following up any positive test with a colonoscopy significantly lowers your chances of getting colon cancer and dying from it. A stool test carries no risk of physical injury. But some people will have a positive test, and they need to have a colonoscopy. Having a positive stool test can be a little scary, but most people who have a colonoscopy after a positive stool test do not have cancer. Several conditions that cause bleeding, like hemorrhoids, can make a stool test turn positive, but have nothing to do with colon cancer. It's time to wrap up. You've heard a lot about both of these tests, and both have advantages and disadvantages. But one important thing to remember is that the chances of getting colon cancer and dying from it are much lower for people who get tested. Colonoscopy protects you slightly more than the stool test, but either test reduces your chances significantly compared to those who never get tested. We hope this program has helped you understand the importance of getting tested for colon cancer and the options you have. Your doctor may recommend a particular test, but the decision is really yours to make. What matters most is that you make a decision that is right for you.